so excited to finally be here. This has been such a project of love and passion for everyone involved. Welcome to the Magee Women's Health Lab, a podcast for Magee Women's Research, where we dive inside the research shaping the future of women's health. So excited to be here with you all today. We want to give a huge shout out and a warm thank you so much to our sponsor, Genentech. Genentech is focused on improving healthcare in conditions that exclusively, differently, and disproportionately impact women. In Genentech, we love what you do, and we're going to be jumping into, obviously, the reason why we're all here is exactly that. My name is Kelly John and today I'm joined by Dr. Coralie Toll from the UPMC Magee Women's Hospital.
Hello, Kelly. Thanks for having
being
me.
here.
So yes, I work for Magee Women's. I've completed all of my training there, and I'm now in the division of urogynecology and work with MWI as well for their important work. And I'm excited to be here.
Oh my gosh, me too, especially because for all of our friends watching, Dr. Coralie Toll is with child. So now, more than ever, we're going to be talking about how a lot of this research wasn't even started. We knew a bit about pregnancy, but that is really the only reason why we knew anything about women. That's what I'm gathering, and I'm not a medical professional.
Yeah, no, so for a long time, that was the main thing that people thought about with research regarding women. And so today we're talking a little bit about what is the history of research surrounding female and women bodies, and kind of what does the future potentially look like?
Absolutely. And it is staggering, I will say. Today, we're just going to ask a simple question, really. What the health? I think that is a great way to start it off, because it does come with a little frustration, since I have become such close friends and partners with everyone at the Magee Women's Research Institute. They have told me statistics. Like my friend Joan has told me statistics that I've said, well, I'm sorry, what? Absolutely not. We're going to share those today, and then also back up why the work that you all do is so important. So,
yes. For our very first episode, we really wanted to dive into why everything that we'll be discussing on this podcast really matters, and the disparities that MWI is really trying to address. And there's a lot of big issues in medicine that most people don't even know exist until we talk about it. And so that's what we're trying to do today, is start that conversation on a broader scale and get it into more people's brains and thoughts. And so before you partnered with Magee Women's Research Institute, how much did you really know about the history of women's health research?
I am embarrassed to tell you this, Dr. Toll, not much. Actually, nothing at all. I just assumed medical research was medical research. We were all involved because we're all humans. Men and women obviously operate two very different ways, and I'm not just talking about the way that we live our everyday lives inside too. So I just assumed we were included, and that was silly. I learned.
Silly or not silly, but you're right. It can be surprising to learn kind of some of these facts. And so what surprised you the most, per se?
I would say that women were not considered, so much so that the research behind the things that we did, the medicines we took, the therapies that we went through were all based off of a man's body.
Yes.
Is that correct?
Yeah.
Okay.
And or, male study species as well.
Sure.
True. Things like that. And research is tricky. A lot of research is trying to answer complicated questions in a very standardized way.
Right.
And so a way to try and standardize things is to eliminate some of the aspects of female bodies that can be different, such as menstrual cycles, pregnancies. So in a large way, historically, it was really easier to almost eliminate us from the picture because we had these extraneous details that might confuse the picture. But at the same time, I think what we're all starting to realize is we need all that information. That all needs to be, we need to figure out a way where research includes us, because just eliminating things that are inconvenient doesn't answer the question as completely as we need to. And we've discovered that in all across the healthcare spectrum.
Absolutely. If menstrual cycles feel inconvenient to you guys, imagine how inconvenient they are for us.
That's true. Yes.
That's all I'm saying. But also, this is all kind of just boiled down to a bigger problem where women receive care based on evidence that wasn't fully developed for them. And also, I am so far from medical school. I went to Penn State to just talk for exactly what we're doing. But that doesn't feel at all as though we could come to a solution to someone's problem if based on a male body that doesn't have, I'm thinking just doesn't have simply like the same genetic makeup, the hormones.
Yeah, and not even the same organs. There are obviously similarities between the sexes,
Sure.
but there are a lot of differences. And we know about some of those differences in the patients we see, in the stories we see, and some of the data that we get when we can kind of observe everyone. But what we don't understand is a lot of the times the why and the how. And the why and the how can help us understand how to offer better therapies, better solutions. And that's that important kind of base of research that we really have been needing to continue to explore more, because yes, a male body is not the same as the female body, and understanding sex specific research and those differences is so important.
Absolutely.
Yeah.
And what you guys do every day, I realize that you're in the thick of it, but I haven't said it to you yet. I've said it to all of your peers. It is so insanely important to every woman on this planet. It's not just every woman underneath your roof in Pittsburgh. This research goes around the world.
Mm-hmm.
So, I mean, Magee's Women Research Institute, they are truly saving and changing lives. But I really want to make this real. Can you give us examples where women experience disease differently? Because obviously it's not all black and white.
No, but some kind of real world examples that I think probably many people listening have either had affect their families or their friends are things like heart disease. You may classically think of that as a more male-specific disease, but it happens across the spectrum, and it's actually the leading cause of death for women. But women experience heart disease differently than men, and kind of some really important factors, including how we present with a heart attack. It's not just crushing chest pain and clutching your left arm.
Well, we're doing a lot right
now. Like we see in the movies. And, it's not, those are those really classic symptoms. And those classic symptoms were actually based off male research. And what we now understand is that female bodies present a lot differently. They can have things like fatigue, nausea, shortness of breath, back pain, or jaw pain. These can feel really nondescript, but when we're talking about a heart attack, not understanding that those could be very real symptoms could have women being dismissed or having a delayed diagnosis, which matters a lot, especially in regard to heart disease.
I would say that's life and death, quite literally.
Yes.
Also, you just named, I feel, as symptoms that women go through every single day and fight through.
Yes.
And in not a martyr way, but just because sometimes existing as a woman is just uncomfortable, whether it be that time of the month, or maybe you're picking up the kids a lot and your lower back pain, all these things. I mean, nausea, we've all just felt a little uneasy and went on with it. So it really is amazing how these symptoms can present as something that maybe we do fight on and get through our day with, but should be looked at.
I mean, and I do think a lot of this goes back to understanding and really validating kind of an experience that's different from what we've understood before can help, because I think a lot of times we weren't understanding what symptoms could correlate with, and so then thus dismissing and have internalized for much of our female population that they should just deal with a lot of these things, or that this is just normal for them. And I think what I hope in the future is that we can understand, yes, sometimes a little fatigue is just fatigue, but understanding how someone can really listen to their body, advocate, but also not need to advocate so much, because they might just be, heard and believed and understood better when the research really matches their experience.
Right. Heard, believed, and understood. I think that's just what women want in general in life, but especially when it comes to medical research. And this was one of those stats that I talked about before, that when I was given, I don't want to say it boiled my blood, because I know now it's in the past. And I know now that we have amazing people who are trying to tackle this issue every day. But only 1% of healthcare R&D funding goes to female-specific conditions, excluding cancer. So cancer is obviously given a couple more dollars, despite affecting half the world's population.
Yeah.
So
51%.
Yeah. Take that. No. But can we talk about that and how, I think as a medical professional, you come to terms with that?
Obviously, female-specific conditions are much more than 1% of my life. Because
exactly.
So yes, stats like that are emboldening, but also angering to me as well. So these are conditions like endometriosis, menopause, adenomyosis, fibroids of the uterus, pelvic floor disorders. And this affects such a large proportion of women. Endometriosis is as common as diabetes in women. It's up to 10% of the population. And pelvic floor conditions can affect up to, 30 and 40% of the population, especially by the time they're reaching the age of 65.
Right.
So this is hard because this is a large number of people being affected by this. This is, millions and millions and millions of people, and we have such a small cut of the pie to try and be able to answer these questions. And we can want to as much as we want to, but if we don't have the access and the resources to be able to answer it, we are going to be stuck with not knowing.
Right. And I mean, I'm just thinking about, I have two friends in my own orbit, two friends that have been in my life forever, who both were diagnosed with endometriosis after having both of their first children. And I remember all through our entire lives, I mean, high school to college, their existence just being so incredibly uncomfortable, and them just sitting with that and saying, then I guess this is just it.
Mm-hmm.
This is just the way that I'm going to live every day of my life. Mm-hmm. And I mean, again, emboldening, I think, is the perfect word, because it's nice to know there are silent soldiers who are helping get the research out there all the time to make sure that your existence isn't uncomfortable. It doesn't have to be that way. But without the resources, then you have fewer studies and fewer researchers and fewer discoveries, just like the one we were talking about, and slower progress for patients, because those friends that I've talked about, obviously, they've been diagnosed, but after that, there's still a long road to travel.
No, and there's still, every time we have an exciting breakthrough in research, it can be really invigorating, but research takes time.
Yeah.
It takes a lot of time. It takes a lot of resources. It takes entire institutes built just for it. It takes a lot of people really believing and supporting it. And I think that, even within the medical field, there's a lot of people in the medical field who may not actually have their hand in research every day or as much a part of their career. But everyone in the medical field, I imagine, has an appreciation for the discoveries that research has gotten them. But even that, it can be easy to lose focus of just how important it is and how necessary it is if we're ever going to have kind of the next solution or the next answer for these really big problems like endometriosis that our patients face. For example, even in my time of training, since I started going on, understanding the stat that we're kind of getting right now, in some ways, for women's health conditions, we're working backwards. We get this kind of observational data of understanding, it can take people 7 to 10 years to get to their endometriosis diagnosis. They can be having these symptoms for a decade. And that's a stat that I didn't know my first day of medical school, but I know now. But we still don't know so much about endometriosis.
Sure.
So now I have a better awareness as a healthcare practitioner to always keep that in the back of my mind, always be thinking about that when I'm talking with a patient, and be thinking about that 10 years and trying to fight that 10 years. But I'm one person in a big pond. I would be able to do so much more if we were to be able to do some of the things like we're working on, like tests for endometriosis,
Right.
and improving our diagnosis and improving our treatments for it. So it's just an example of kind of how we are fighting this.
Yeah, and I think fighting it is truly what we're doing right now, because there's such a gap there that you can't fix. We can't rewrite history. We can't go back to, the beginning of recorded medicine and say, you know what, I think the ladies have some differences and we should probably include them. So it's almost, I don't want to say cleaning up someone else's mess, but it's also reteaching yourself that we have to be tolerant of the way that history was written, and it's our job now to change it. And you all are doing that every day.
Yes. And I think that's a real goal of both Magee and the Research Institute is a paradigm shift, is a true shift in priorities. Hopefully, our goal is to make the stage as big as possible, the message heard as wide as possible. But this is important work. And if I can add even more why it's important, this has economic benefit to the country, to your own community, to your families. If we could close the women's health gap, we could add $1 trillion to the global economy every year. And I'm not making this up. I've always known that supporting women would support communities. But these are from people like McKinsey and Deloitte. They estimate that by investing in women's health, we could generate $1 trillion in annual global economic gains by 2040, which is not that far away.
Not at all. Not at all.
And this can be things by improved productivity, workforce participation, and just healthier lives, because One thing that I have known since one of my early days in medical school is that when women are healthy and able to be healthy for their families, the entire community and society benefits. And that has been shown time and time again all across the world.
Yeah, and I mean, I think about how the mom's mood. I mean, if we can all go back to being younger, when your mom came home in a bad mood,
Yeah.
the house was in a bad mood, and it wasn't at all because she wanted it to be that way. It's just that's the woman is the heartbeat of the family and truly gives the heartbeat to the community. So it is important to include us all. I think have I made that clear today? I feel as though I feel like I'm crystal clear. For 50 years, Genentech has pursued groundbreaking science to discover and develop innovative medicines for people facing serious and life-threatening diseases. Genentech is focused on improving healthcare in conditions that exclusively, differently, and disproportionately impact women. When we study women, we make these discoveries, and they're so incredibly important. And especially with the economic impact, I'm thinking about like all the healthcare women wouldn't have to get because they're not out there just grasping at straws, and all their medical providers aren't trying things they actually know.
Yeah. I mean, this is one of the most basic, core philosophies in healthcare is that it's better to prevent a problem than to treat a problem. But it is so much more abstract, I feel. It's hard to really get everyone on board with that because it means doing some work that may feel a little unnecessary at the outright to try and prevent a bigger problem down the line. I mean, this is what I would want for everyone. I would want to treat you before the hypertension, before the diabetes, before all of those things become problems. Obviously, we're here and we're going to treat whatever is happening, but a healthier life can really start when we can do some of these preventative measures. And that is so much true for women as well, who can sometimes be less likely to seek healthcare or have more barriers to being able to access healthcare due to families and responsibilities and things like that. So yes, our goal would be to be getting ahead of some of what we've been behind on.
Right. And there's someone listening right now who has missed a cardiologist appointment because she had to take her kid to soccer practice. And I urge you to go to the cardiologist. And I know this because you are in my life, and I may or may not have done the same myself, but we are changing today.
Or your pap smear, or your colonoscopy, or your mammogram. Just shout out for
all
any of those.
And we know these are a blast, but save the little treat, the little coffee treat on whenever you leave.
I do always say, too, I talk with patients about this every day. I was like, look, I'm a bad patient myself. I understand that it's hard in today's society to get the access we need and the time we need. But I try to remind them and myself every day just how important it is to kind of be taking care of yourself.
Absolutely. Yeah. We need you and we need them. So we're all changing. And this kind of brings us all back to Magee Women's. When people hear Magee Women's Research Institute, what do you want people to know? Because I have learned so much in such a short amount of time. I want to scream your mission from the rooftops.
Yes. So the goal and the entire purpose of Magee Women's Research Institute is to change the future of women's health, and to change it both in big ways of knowledge and also in direct ways that patients will see and feel. Women's health, we mean conditions that affect women exclusively, differently, and disproportionately through every stage of a woman's life, really from the beginning to their end stages in menopause and beyond. We want to discover answers that don't exist yet. We want to build upon knowledge that we already do have. We are a nation's leader in women's health, and we are one of the only freestanding women's health research institutes, and the largest one at that. And so it is not just a specialty to us. It's not just OBGYN. Women's health is much broader than that. It extends beyond one specialty, and it's important to us in that way.
And what stood out to what you just said was, tell me about how women experience things differently, disproportionately, because, I mean, obviously we do, but I feel as though some examples might help on that.
Yeah. So, I mean, the first and maybe most obvious one that comes to everyone's mind is reproductive health. And that can include everything from pregnancy, but also infertility, and menstrual changes, including things like endometriosis. Maternal health, postpartum depression and anxiety, pelvic floor disorders, things like prolapse, stress urinary incontinence, cancer, including cancers like ovarian cancer, endometrial, and breast cancer, but also other cancers can be affecting women differently. Heart disease, Alzheimer's, and aging.
Yeah. That's the truth. Why do men get to do it more gracefully?
Yeah.
We get it. All right. We get it. But I think that all of these things are incredibly important. And I also I do want to mention all the amazing men at the Research Institute who truly are advocating for this every day. Because I know right now it's easy to say, oh, they get everything so easy. They got all the funding. But your entire staff really has come together on this mission to
Yes,
make
no,
everyone more
absolutely.
comfortable.
Women's health is obviously Magee Women's Research Institute primary focus, but it takes more than just women to address this issue.
Totally.
And so we have an incredible community and staff that are really at a turning point, and our focus and our values are, I think, more aligned than ever. I think there's a growing recognition, and we want to contribute to kind of this, national and global conversation that women's health isn't a niche thing. It's not a small portion of the pie. It's actually a very large portion of what we should be focusing on. And it really is human health. And so we need to start recognizing women as half the population and a true, equal half of the population. Because if we don't, really everyone loses, even those outside of women.
Absolutely. And awareness really is the first step, because there's something about a mission that can support 51% of the human population that you can get behind. We all have a mom. We all have a sister. We all have an aunt that we want to live forever and be immortal. I know, I too do as well. And these are the people who are going to make sure that they live long, comfortable lives and that they live comfortably. Because I think, again, so often we all have just become so used to living with illnesses, specifically chronic ones, that we don't have to anymore. It is 2026. Thank goodness for that. Now, if someone wanted to support the Magee Women's Research Institute and right now you wanted to tell them how to do that, what would you do?
Well, first off, it is 2026. You could follow us on social media at Magee Women's. You can ask questions, both of your family and friends, and also when you are in your healthcare provider's office. You can advocate for yourself and loved ones, and you can support organizations that are advancing women's health research. When you are offered opportunities for research, it's great to be open to hearing about it and participating. I just agreed to a study today in pregnancy. And you can talk about these issues and kind of continue that momentum. But research really is important. It's how we get new answers. And I hope that everyone's encouraged to contribute to women's health research.
Well, thank you so much for your time, Dr. Coralie Toll from UPMC Magee Women's Institute. You are amazing. I wish you a smooth rest of your pregnancy and more research to make sure that every pregnancy goes smooth in the future.
Thank you. And we're very excited for all the topics that we will be discussing in the future on this podcast. We will have guests and other experts in the field to come in and talk about some of these things that we only touched on today. So if you would like to hear more, keep staying tuned and we'll be seeing you.
There you go. It's episode 1. It's only going up from here. So excited. Thank you for tuning into the Magee Women's Health Lab. It was my absolute honor to be your host again today. My name is Kelly John. I want to give one more huge shout out and again a warm thank you to Gen Tech. They're focused on improving healthcare and conditions that exclusively, differently, and disproportionately impact women. We'll see you next time.